So, welcome to our online virtual meeting. So thank you everyone for joining us. So today's session will be covering mental health, and Barnet, Enfield, Haringey Mental Health Trust leaders have kindly joined us. So before we kick off and do introductions, etc., I will just do some housekeeping. So I've talked about being off camera and off mic, if that would be really great because of the connections. If you experience any problems and you can't hear, it's very likely, unfortunately, that we can't do very much, that you'll just need to log off and then just sign back in again, and that just might make the difference. But there's lots of issues around connections. So if you can be mindful of that. Also, if you want to check your view, if you want to do two different views, you can click on the right-hand corner for most, and it will tell you there's some little boxes, little dots in a square box, and it says gallery view, and that will give you all of the presenters. Or if you want to do speaker view, it's whoever's speaking at the time. For anybody who is deaf, we are hoping that we'll have our BSL interpreter join us shortly, but they may be experiencing issues, which I'm guessing is the case because they would have joined by now. But hopefully, as and when they do join, if you want to pin the BSL interpreter, what you do is click on the right hand corner of the actual person's video, and I'll flag when she joins, and click on hers, and then it pins it, it holds her so you can see her signing. So I'm just checking that we've got everything. The other thing I'd like to do is with the invites that we sent out, we also have got an evaluation. So in case we forget, it would be really great for you to give your feedback on this call, because everything that you feedback we try and look into and helps us improve the calls that we're having. So without further ado, I'm going to make a start. So my name is Fazila Ahmed, and I'm the acting Chief Executive for Healthwatch Enfield. So welcome. And with me, we've got I will introduce Jackie Laveras first, who's the Managing Director for Barnet, Enfield and Haringey Mental Health Trust, the Enfield Mental Health Services Division. And just note, because we're all using kind of personal computers, etc., because of Zoom, her name says Anne Creek, but actually it's Jackie. So welcome, Jackie. And we've got Andrew Wright, who's the Director of Planning and Partnerships for Barnet, Enfield and Haringey Mental Health Trust, again for the partnership. And we also can welcome and I have been practicing this, Anagnostara, who is the Head of Nursing, also for the Trust, and is working for Enfield Mental Health Services Division. So welcome and thank you, because hopefully it will make an interesting conversation. We've had lots of questions from you, so we will be taking those shortly. I just wanted to give you a quick update on what we've been up to, and also then Andrew will give you an update in terms of what the Trust has been doing, and then we'll take your questions. So in terms of Healthwatch Enfield, a couple of things I'll just pull out in terms of mental health so that it's appropriate. That we have been working with Enfield Council with their befriending service, contacting those who are shielding, and actually a number of them have wanted regular calls because they've been feeling isolated, concerned. They haven't had people to talk with where they can air those concerns, and actually that's been quite an interesting and I guess challenging time for people. And I think we probably need to bear that in mind as we go out of lockdown and people start to be told that they no longer have to shield. I think there's some questions that we'll be taking that kind of address that. Suddenly you were asked to shield and suddenly you can't. The other thing that I wanted to flag was that we've been doing a couple of reports. We've been asking for people's feedback for Young Healthwatch, young people between the ages of 16 to 25, and a third of them are reporting mental health concerns, which is quite significant. And it's interesting also that we're just developing analysis around another report that we're working on, and this is around the general population and the impact of COVID. And again, similar figures, around 30% are reporting anxiety and mental health concerns. So it is a real hot topic for us. But without further ado, I wanted to just say one last thing, and then I'm going to hand over to Andrew. Again, in relation to mental health, there's lots of conversation around that we're all experiencing the same thing, you know, we're all in the same boat. But actually, you know, I've heard other people say that's not necessarily the case. We are all in the same storm, but potentially we're all in very different boats. So you can get some people in great yachts and having quite a pleasant time in some instances, and others might be in a very small boat or in a dinghy, you know, with 17 people crammed in, and they're just trying to get the water out because they're really struggling. So I think it's really important to acknowledge that we're all experiencing things differently depending on our own circumstances. And I just want you to acknowledge that. So I'm going to finish now and pass over to Andrew. If you can then perhaps just give us an update, that would be great. Thank you.
Thanks very much, Priscilla, and thank you for inviting us to come along today. We hope this will be an informative session for you. There are some questions that people have sent in, but obviously if there's anything following this that you'd like more information about the Trust and our services, then please do contact Healthwatch, and we'll be pleased to respond to that. I know that some of you watching will know quite a bit about the Mental Health Trust. Some of you may not know so much. So just in a minute or so, just to give you a brief overview of the Trust. We provide mental health services to local people across the 3 boroughs, so across Enfield, but also in Barnet and Haringey. We also provide the community health services in Enfield, so a whole range of physical health services for people who don't need hospital care but need additional support. So we provide services, some services for children, some for adults, some for older people, and they're primarily about helping people to either keep them out of hospital, or when they've been in hospital to help them get back to normal life. We're not focusing on those services today. We're going to have another session with Healthwatch, hopefully fairly soon, to talk about those, and we'll have colleagues from our community health services division joining us for that. So today is about mental health services, but it's important that we just note that we provide those other services as well. And one of the really exciting things that we're looking at as a trust is about how we can bring together our mental health services and our community services to people with physical health conditions to provide more joined up care. So the buzzword you may have read about in the papers is called integrated care. So it's about, we're all whole people, and often our mental health and well-being affects our physical health and well-being, and vice versa. And so as an organisation, we're wanting to develop that aspect of our care much further over the coming months and years. And again, that might be something that we want to talk about in the other session, but that's a real priority for us as an organisation. In terms of our mental health services, so we provide a full range of mental health services, both for children and young people, for adults of working age, and for older people across the 3 boroughs. And we also have a range of what we call specialist mental health services, which are very specialist particular services. So for example, we provide a specialist eating disorder service for local people, where that extends much further than just the 3 local boroughs. We also provide psychology services, specialist psychology services, and we've also got a range of what we call forensic mental health services, which are for people who have been convicted of a criminal offence, who have a serious mental health condition, and we provide those services primarily from the Chase Farm site. And again, they serve a much larger population than just Barnet, Enfield and Haringey. The other really important point, just to understand how our services work, is that for the vast majority of people living in Enfield, if they have a mental health condition, they will be able to receive care and support from their GP and from others. So our services are primarily for people who need a bit of extra support, and there's a whole range of services, and we can talk a bit more about those later. But they are primarily dealing with people who are referred to us by their GP because for whatever reason they need a bit more support. And most of those people are supported in the community, and there's some questions we'll talk about that. So in their own homes, but there are a small number, as many of you know, who do need, for a period of time, admission to a mental health ward. And for Enfield, they're all on the Chase Farm Hospital site, both for adults and for older people. But they are a relatively small, in fact, a very small proportion of our overall patients. And most of our patients are at home, and the job of our teams of staff who primarily work in the communities to help people where they can to continue working, help them in their normal everyday lives, and provide extra support where that's needed. But we work very closely with our colleagues in primary care, with GPs, because they are the majority of people nationally who need support for mental health conditions will be able to get that from their GP. So that's important. And mental health is all about partnerships, really. So primary care on the one hand, but also other partners, for example, the local authority, Enfield Council, we work very closely with them. So for those who use our services, often they need a whole range of other services, and a big part of our job is about helping people to find the right care and support, and to join up other services. So that's a brief overview of the Trust and what we do. And just for a moment, just to give you an update in terms of how coronavirus has impacted us and our services and those who use our services. We, like the rest of the NHS, have been on a major incident, and we are still formally in a major incident, which means that we have to prioritise things according to the national government guidelines and government requirements. Coronavirus affected
Andrew,
us and our services. Yeah.
Sorry, I'm just noticing that the chat. Our BSL interpreter. Are you able to, Simone, lower your camera so that they can see your hands as you're signing? I've just seen.
Could I just ask Andrew as well to speak a little bit slower?
Sorry, yes, I will do, Simone. Apologies. Apologies.
Just a little bit. Thank you.
Apologies. It's just because we've had Simone come in a little. So, can people see her now? Is that okay? Yeah. Okay. So sorry, Andrew. I rudely.
No, that's very helpful.
You carry on.
So just to tell you a little bit about coronavirus and how that's impacted on the Trust and our services. We, like the rest of the NHS, we've been in a major incident, which means we have to follow the government guidance and government requirements. We have done, as the rest of the NHS has done, we've separated our services, particularly our inpatient services, into areas for people who've been diagnosed with coronavirus and people who haven't. So we're isolating patients. And again, I think we've got a question about that. All our staff have been trained and equipped with the appropriate personal protective equipment. We have seen an initial reduction in people coming to our services when the pandemic was at its height. For obvious reasons, many of our service users were slightly less engaged, and there were fewer admissions. It's probably fair to say, and Jackie will comment on this in a moment, that our demand on our services has increased again now that lockdown is, the restrictions are lifting, and we are expecting, we'll talk about it further in one of the questions, but we are expecting a larger increase over the coming months as more people are affected by coronavirus and lockdown, and also the economic impact of lockdown. All of those things we expect will impact on demand for our services. So we'll talk a bit more about that. Obviously, it's been very challenging for our staff. We did have a small number of colleagues who sadly contracted the virus and died in service, including several in Enfield. So that's been really difficult for us as an organisation and for staff. But overall, I think we've managed the pandemic well. the feedback from service users is that they feel supported and have continued to feel supported, but it has been a difficult time for everybody, and although things are improving, we are still very much in the mindset of responding. And of course, as we all know, there is the potential for further outbreaks, either nationally or certainly locally. So we continue to be very focused on that, and we're testing staff and patients, which Every will talk a bit more about later. So that's probably enough in terms of general introduction, because I'm conscious people want us to talk through the questions.
No, that's been really helpful, Andrew. And I think, you know, it's useful to also think, we always think about the general public and local residents and their mental health, but of course it's impacting staff equally. And I know, you know, staff are suffering equally with some of those mental health issues and anxieties. So, you know, it's across the piece, isn't it, that we need to think about that. So without further ado, thank you for that. That was really helpful. I wanted to just flag about another option for those of you who may be unfamiliar with Zoom, that you've got a chat option. And what that means is if you squiggle your cursor around on your screen at the bottom, you'll see some icons, and you'll see a chat function that's got like a speech bubble. If you click on that, you'll see at the side of your screen, you'll get a kind of section where you can write. So you can see at the very bottom of that right-hand section, it says to, and you can do it to everyone so that you're asking a question or you're wanting to make a comment. And we will keep those. If they're very new questions, I might not be able to answer them or ask the panel unless we have extra time. We are going to prioritise the questions that came in first. But if we do have time or they're very similar, I will bring them in. So feel free to ask a question or comment on the chat as well as we go along. So I'm going to kick off then with the question to yourself, Andrew. And we have got a number of questions, so I guess we need to, you know, bear in mind Simone, but yeah, just make sure that everybody is clear in the answer. So the first question is, what extra support is being offered to those with mental health issues, especially since COVID started? So is there any additional help that's been offered?
Yeah, so I think, again, I'll go back to what I said a moment ago about mental health care really being about working in partnership with a whole range of partners. So we provide a whole range of services for local people who have particular mental health needs, but we also work very closely with Enfield Council and their teams for children and young people, and for adults and for older people. And what I didn't mention, we also work very closely with local voluntary organisations, and I'm aware some of you on the video probably work with or are part of local community and voluntary organisations. So providing mental health support for local people really is a partnership between us, the council, and all of the other players. So that's the first thing to say, and it's important that there is no way that the Mental Health Trust could support everybody who needs support without the valuable partnerships with many others. And for many people, it may not be the specialist clinical care that we're able to offer, which is most appropriate for them. It may be social care or help with benefits or help with housing or a whole range of other things. And one of the things that our staff do is to refer to others and make links with others where that's appropriate. But we have looked at how our services are provided, and one of the big changes, probably the biggest change since the virus, is that many of our services and many of our service users are now engaging with our staff virtually on things like Zoom, and we have a package called Attend Anywhere, which is effectively an equivalent of Zoom but more secure, so that you can have a confidential conversation on it. So we set that up during the height of the pandemic, but actually for many patients we're continuing with that. We'll talk a bit later. That's not appropriate for everybody, and it's not appropriate for every appointment, but for some people, for some of their appointments, it definitely is helpful. And that's helped us to provide more care to more people, and that's one of the ways that we anticipate that in the longer term we'll be able to continue to support local people if demand for our services increases. The other probably major thing we've done is we've established a new 24/7 helpline for people with mental health, what we would call a crisis, so a particular pressing need. But anybody can phone that number. It's on the Trust website, but I think Healthwatch have that information as well, and we can certainly provide it. But it's readily available on the Trust's website. It's a free phone number, and essentially there's a clinical team member there who will listen and who will either refer to one of our services or refer to someone else somewhere else who can help. But the idea is there's someone available 24/7 all the time. And although we had some aspects of that, it wasn't 24/7, and it also wasn't serving the whole of our catchment across the 3 boroughs. And that was something that was nationally been planned, but actually it's one of the benefits of coronavirus, actually, and it helped us to achieve that much more quickly. So that is a real port of call for anybody really who needs advice and support. So that's probably the main thing, how we've been responding.
Okay, that's great. I think I might have the number here. I'll just read it out and maybe somebody can put it on chat. But the 24/7 helpline is 0300 0200 500.
That's right.
Just if anybody needs that. So thank you. That was helpful. And I guess it's really important to think about it. Isn't, you're kind of dealing with crisis mental health, but obviously people are building up to that, and therefore that's where the community comes in. Social care, GPs. I know there's a comment there on the chat that GPs are struggling also in terms of referrals. So I guess it's looking at how we can help within the system. But I think you'll come on to that later. So we've got another question here. How can you, just on that point, how can you help people to help themselves, particularly following lockdown? And that might be with agoraphobia, they're being, worried to go out now. How do they help themselves?
Yeah, so in many ways, I think the general advice hasn't changed. So all of our clinicians would say looking after your mental health is very closely linked to looking after your physical health. So things like exercising regularly, eating a balanced diet, those sorts of things will definitely be beneficial. I guess the particular issue for us all at the moment is being isolated and perhaps not having the social contact, and there's no doubt that does impact on all our mental health. So I guess the general advice would be, where you can within the government guidelines on social distancing, it's obviously good to get out, where you can meet with family and friends, because that social contact is really beneficial for us all. So there probably is, in a way, the answer is perhaps less clinical, and it's more about just looking after our overall health and well-being. But I think we are aware many people have been and probably still continue to struggle with the isolation, and anything that we can do, even if it's phone or Zoom contact and all those things just help us to feel more balanced, and to not feel that we're carrying everything ourselves. So that's one of the underlying issues for all our mental health, is feeling that we're alone and we're struggling on our own, and that if we can share that with others, then that's definitely helpful.
Yeah, and I think that's where the befriending service, just telephoning a neighbour, a friend, just having a chat with them over their garden, or I'm just conscious again for the deaf, if they can communicate amongst themselves in their own community. And obviously provide support for all of those with disabilities, because sometimes they can find it much harder to kind of engage. But I think there'll be another question on that later. So you were talking about Zoom sessions, and kind of that's actually been really helpful, but equally you have said that that isn't for everyone. So the question here is, what plans do you have to re-establish face-to-face sessions for those who need it? Because actually not everybody has IT access, or actually they don't feel that they can engage properly.
Yes, sure. I'll answer that
Okay.
one, actually, Priscilla. Hello, everyone. So basically, the face-to-face contacts have not stopped. Even during all of this period, the people have continued to be seen face-to-face. Obviously, we've had to be very, very careful to make sure we're keeping people safe, keeping everybody who uses our services safe, and also all our staff safe. However, we have also been using the sort of virtual sort of platforms, which Andrew's already talked quite extensively about, and we have got a new system in place to do that. It will be appropriate for some people to continue with that way of communicating. Some people who use our services actually prefer that. If it's a quick catch up, if it's just a check-in with somebody and check they're okay, then it may be appropriate for us to continue to do that. Obviously, our preferred choice is to come and see people face to face, to sit and talk with people, to support people, and that the preferred option is always to do that in person. We will always risk assess about doing that, whether it's safe to come in and see people. And some people may have a choice. They may feel it might be nice to have a weekly catch up with their care coordinator, and to do that on a Zoom chat or something like that. So that would be an option open. So in actual fact, what it does is it just gives us more options, and it gives us the opportunity to give people a choice. But myself, being a nurse by background, I always know that my preferred option would be to see somebody and to come and talk to them, sort of like face to face, really. So that's what we're doing.
Right, thanks, that's helpful. Just going back quickly to Andrew, there's just somebody's asking for clarification around the 24-hour helpline. Other than advice to people in crisis, how is it different to the crisis team?
Well, it's not a replacement for the crisis team. It's really a coordinated access point. So it's an access. It serves two functions. One is it coordinates access to our services quickly and helps to make sure that people get referred to the right team, the right place. And it also serves a help function. So some of the calls, in fact, actually the majority of the calls that we get when we've talked through with the caller, often it involves a referral to another partner. But we can do that because we've got information on who to speak to, for example, at the council or somewhere else. We can refer directly on. So speed of access, rather. Okay. That's right.
Okay, thank you. Yeah, just wanted to clarify. We've got a couple of questions here around shielding now, and I think they're still for you, Andrew. For those who are shielding, it says, has any mental health support been set up to help those who were in shielding, and now suddenly we're being told that on the 30th of July, 31st of July, actually it's not an issue and you can come out? And do you anticipate any issues and anything that you can be recommending or supporting?
Yes, so we are working with Enfield Council and indeed with Barnet and Haringey councils as well. That there is a series of work and programs to specifically looking at people who've been shielding, both in terms of supporting them up until the end of the month, but then afterwards. Again, it sort of goes back to the point that a lot of people, their support may not be from us as an organisation. It may be from a whole range of other partners, but we're actively involved in that, and certainly all of the partners involved recognise that for that particular group of individuals, now is quite an apprehensive time, looking to the end of the month, and starting to go outside, for example, which many of them won't have done literally for several months. So there is definitely a need for support. For some people, that can be from their GP, it can be from voluntary organisations, and as you said earlier, it may simply be from friends and family as well. It doesn't necessarily have to be from some of our specialist services.
No, and I think that's the key thing. We talk about mental health, but actually, we can all maybe think about how, who might be a point of support for us that we kind of can support and help. And I know certainly from Healthwatch, we'll maybe look at if we can provide further information and get that information advice out there. There's also another question around, again, health-related anxiety. So the question is, has there been an increase in health-related anxiety since COVID? And again, will there be any targeted help specifically aimed at people struggling to deal with these changes and uncertainties that COVID's brought? So will it be, can there be a self-referral, or is it still GP having to refer?
Yes, I'll answer that. I mean, basically, yes, we have unfortunately seen an increase in anxiety, and understandably as well. Things have been very frightening for people over the last few months. It's been very, this has been an awful time for us all, really. And I liked what you said earlier about the storm and the boats. Actually, that's really helpful. Yes, I mean, we do want people to access services directly to us. There is, of course, the access to the crisis line, which Andrew's already mentioned. I mean, sometimes anxiety can be managed by a GP, and depending on the severity. So, it's always a good idea to just check in with your GP first, have a conversation with your GP about how severe the anxiety is. And then, of course, if a referral into our services is necessary, then access will be swift, and we definitely will be seeing people with, anxiety disorders, anxiety difficulties. So, as I said, a good idea to have a chat with your GP. If it feels really, really, urgent, then always our crisis line will be available.
Thanks, that's helpful. Yeah, I think, lots of, what was normal just a few months ago now, suddenly, even shopping can suddenly become quite fearful, and everyday life can be quite fearful. So I think it's all of us kind of helping one another as well. So there's a question here, and I think it might be for you, Every. How will Enfield Mental Health Services ensure people that are discharged from hospital or in the community are COVID aware?
Thank you, and hello everyone. So we are doing a lot of work with the central government to make sure that the guidelines of the government is filtered down to all our services, in particular with inpatient services. We have a lot of information cascaded to our patients in the form of anything from one-to-one with our healthcare staff, things like teach people how to wash hands correctly, how to wear correctly protective equipment like masks, for example. We give a lot of advice of how you can keep yourself well during the pandemic in terms of either spreading the virus or contracting the virus. And we have this available information in terms of leaflets on the wards, as I said, health promotion through occupational therapist sessions, and so on and so forth. Definitely upon a discharge from hospital, we want people to remain well, both mentally and physically, and we will give as much advice as we can, and we will help support their recovery, including how to deal with COVID.
Thanks, Evie. That's helpful. I'm just pointing you also to the chat, where on our website we've also got some useful, helpful information around mental health and how we can support. There are a couple of questions on the chat. One of them was about Swift, Jackie. I don't know whether Evie you can answer or whether that goes to Jackie, but there was a question around, you were saying, if the GP refers, that you would actually swiftly support. What are the kind of current timescales or wait times now, just being realistic and kind of practical?
Should I answer or?
If you can, or if it's Jackie, if you can answer, that's fine. Every.
Sorry, I was having a bit of trouble coming off mute, sorry. But I do chip in. I mean, it all depends on the urgency. I mean, at the moment, we have got a couple of timeframes in place that our commissioners are keen that we work to, which we do, which is a 4-hour and a 24-hour response, obviously for people who are either in emergency or urgent. You know, what's happening is urgent. Generally, we try and see people routinely sort of within a week, but really the national standard is 28 days. So we do have like a month to see people, but we see people as quickly as possible. And all of that will depend on sort of the urgency and how the person themselves feel, how quickly they need to be seen.
Sorry, I was just on mute then, saying that's helpful. It just gives you kind of understanding of what the wait times potentially are. There's a question here also, I think, Andrew, this one was for you, but correct me if I'm wrong. It was about funding. It's saying, has mental health support had any increase in funds to help deal with the added pressure of COVID-related issues and fears and concerns?
Yeah, so there's probably two aspects of this. In terms of the short term, the sort of immediate costs, extra costs related to COVID-19, the government have said nationally that each NHS organisation is to basically add up how much extra we've spent directly due to COVID, and then we will be working with NHS England, which is the central national body, to recoup those costs. So, for example, we've spent a lot of money on personal protective equipment for staff, spent extra amounts on things like oxygen for certain patients who needed oxygen support. So there's been quite a lot of extra cost, which is the same across the whole of the NHS. So the government have given a commitment that they will effectively provide additional funding for that, but it probably is worth saying that is relatively short term, and in fact that is due to end, that arrangement is due to end at the end of this month. But the government did give, and some of you will be aware of this, they did give a commitment last year as part of the national NHS long-term plan to increase the funding for mental health proportionately higher than the rest of the NHS budget, which for those of us who work in mental health was a really significant point, and a recognition that historically perhaps mental health has not had its full fair share of the NHS cake as it needs. Where that now sits, we're not completely clear, because the pandemic has effectively meant some of the things that we were implementing and working on has been put on hold. But we are expecting, in fact, we had a meeting with the local clinical commissioning group last week, and they did commit to that additional funding for mental health services locally would be coming, but precisely how much it is and exactly when we'll see it is still not clear.
So that's still a challenge, really, in terms of that. It's nice to have the commitment, isn't it? But actually, until it's on the ground and you're utilising it, I know, I'm just looking at the chat again. You've got a couple of comments here saying there's lots of patients in the community who won't have been, are not necessarily inpatients, but it's about how do they keep informed, how do they know what's happening, and actually what's, the additional support that would needed for the funding. It's quite hard to plan for if you've, I guess, only got commitments and not actual money in the pot. So yeah, tough one. I'm just going to ask a couple of more questions and then I'll go back to the chat. Questions here, I think perhaps for you, Every. Are there spaces, I guess looking at spacing allocation in the actual mental health wards, or are people there self-isolating? So I guess it's about capacity. I'm assuming from previous where it was lockdown, you were using your beds for other means, but what's capacity like at the moment in the inpatient wards?
Capacity more or less is at this stage is as per pre-COVID era, if you like. But I think it's very important to say that we have dedicated our resources to protect our patients who needed to come into hospital. So in effect of that, we have specifically had the opportunity to self-isolate, if you like, or shield patients who needed to come into hospital for their mental health problems. And we have helped vulnerable people in terms of physical health to stay well while receiving treatment for their mental health. Also, we did a lot of work to ensure that people who may have tested positive, for example, with COVID, have been kept well themselves while in hospital for mental health problems, but also to avoid transmission to others. And I think this is a work that was very intensive for our trust to carry out, but we did it very safely. And I'm actually very proud of the achievement. Especially, I will talk about Enfield in particular, but across the trust as well. So I think it's really important to recognize the efforts in terms of keeping people well, both physically and mentally during that difficult time for everyone. Thank you.
Okay. Thank you. Thanks for that. And I'm just conscious there's some chat. We're trying to prioritize some of the questions that have come through because people have already asked them. But I will try and get back to some of the questions on the chat if, on the basis we've got some time. So I think we might have covered this, if I've understood correctly, that about GPs still referring. I'm hearing that actually they should be referring. It might be a while, a month or so before you get back to them, but that process is happening. It hasn't stopped. It should be happening as normal. There shouldn't be any issues or challenges.
Yeah, absolutely. I mean, the system for GPs to refer patients to us continues. We also have a helpline specifically for GPs. So if a GP has somebody with them in the practice or on the phone, and they're not sure whether to refer or they want a bit of advice, they can contact our helpline, who will speak to one of our clinicians to give them that extra advice. So it helps to speed things up, and it also helps to make sure that people get the right sort of advice.
Okay, no, that's helpful. And there's a couple of questions here for young people. So we have hopefully got a separate call for CAMS in the next month or two. But it talks about here, can young people still be referred to CAMS? And again, back to wait list. I don't know if that's a different wait list to the norm. Andrew, you're on mute.
Okay.
Yeah, I don't know.
I think Every's probably
okay.
Going to answer this one.
Thank you. I'm sorry for the confusion. So, yes, I think the waiting list in terms of days, I think more or less they remain the same. The mental health services, including services for younger people, can be accessed exactly the same. I think we do anticipate an increase in referrals because of the issues that you have mentioned already, for example, anxiety. But I think we are working really hard to ensure that it will not have any impact on our service users. So as it stands, I think more or less the service received, including for CAMS service users, should be the same.
Okay.
Thank you.
Thanks. And they've just, a couple of people are concerned. I guess what they're saying is they're hearing all of this, but it's, I guess if you're feeling it on the other end and maybe you don't feel that you're getting the right level of support or access, it's quite challenging. And we have actually said any individuals who've got specific instances of experience, then do let us know, Healthwatch directly, and we can forward that to yourselves. But more generically, I mean, how do you pick up on feedback? How do you pick up whether people have had a good experience or not, and how do you follow up?
I mean,
May
Jackie,
I comment? Oh.
Yeah, no, go over. Go on, you're the expert.
Thank you. I think it's very important to say that we are all adjusting and learning continuously during this crisis, this pandemic, and there has been occasions, I'm sure, where we have not got it 100%, but this is exactly what we need. We need people to let us know and give us ideas of how we can improve further. Our patient experience team remain operational, and of course, we always want to have informal feedback, but also we value the formal feedback as well. So I would definitely urge people to contact our patients experience team with any specific concerns, and by all means we will strive to make it right for them. Again, I think people understood that it was a difficult situation for everyone, and my understanding is that although there were some issues in terms of what services will go on and what may pause for a while, the experience, I believe, remains the same, and I hope it to be still very positive as pre-COVID as well. Thank you.
Okay, thank you. Just working my way through the questions. So there's a question here which I think might have been covered, but just clarify. Has there been an increase in health-related anxiety since COVID? Will there be any targeted help specifically aimed at people struggling to deal with the changes and uncertainties that COVID has brought? And if so, will self-referral occur, or absolutely is it only through GP? You might have covered that. It might be worth just summarising that. Thanks, everyone.
May I make a comment if that's okay with everyone?
Yes.
Yeah. I believe, yes, we do recognize that there is increased anxiety in terms of the virus itself, but also, like you said before, about reintegrating in the society for the people who have been shielding for 3 or more months. So again, I think it's very important for people to access information about our services in our website. There is a lot of information that we pull out from the Public Health England and the central government. Like you said, Fazila, as well, we have very similar information like the ones that you perhaps have available in terms of how we can self-help and what it means for us to be in a post-COVID era, I guess, for lack of a better word. But again, I think it's very important to keep this open channel with our GPs and our services. Again, I saw a comment about how families can access our services to express concerns about their loved one. I think it's very important to keep on doing that because we are very keen to hear from families and friends. So just to summarize, really, as a starting point, our website, definitely there is a lot of information there, and perhaps GPs. Thank you.
Okay, and if Andrew or Jackie, you want to just chip in, let us know, but otherwise I'll just carry on. There are a couple of the questions, again, I feel may have well been answered. There was a question here saying that, have you seen a greater demand for mental health services since lockdown?
I think we touched on this a bit earlier. Yeah. So during the height of the pandemic, demand definitely fell because people were obviously anxious about receiving care. I think overall we would say we're now back up to the level of demand that we were 6 months ago. So before the pandemic. We are working with other partners across this part of London to look at what the longer term impacts might be. So we are expecting that there will be a longer term increase in demand for the reasons that we've talked about. The other really important thing is the sort of medium to long term impact of the changes in the economy. So if people lose their jobs, if people lose their tenancy, or they're evicted from their house, all of those things can have quite an impact on someone's mental health. So we're looking at this probably being quite a long-term demand. Those of you who remember the financial crisis in 2008, there were definitely mental health services nationally definitely saw an impact, and it took 2 or 3 years for that to work through in terms of the extra demand on services. So we are preparing for that. We're not seeing it fully yet, but we are anticipating and preparing for that.
I mean, that in itself is quite, you know, I was going to use the word depressing, but I think it just shows you the challenging times, because not only, you know, mental health was a real kind of focus pre-COVID, and you mentioned about the government funding coming in, but that's been earmarked but not necessarily landed with you. Then you have COVID, which in itself has its own anxieties around the virus, etc., and fears. And then you layer on that the economic climate and the challenges, perhaps when the furlough ends, etc., as the, you know, the economy starts to bite. I guess all of that is probably hard to plan for, but at least it sounds like you're anticipating. I mean, are there anything that you're doing specifically that kind of think, actually, you know, we know it's going to happen, so therefore we're doing X, Y, and Z, or we're trying to get another unit, or I don't know?
For mental health services, it's primarily about staff. So our biggest constraint, if you like, is having the right staff and the right numbers of staff. So I mentioned the national long-term plan talks about expanding community mental health services and community mental health teams. So that's the long-term plan. I mean, so that's a national plan, but we're working on that locally about having more staff to be able to support people in the community, which then should help to reduce the demand for our inpatient services. The other area that we've not talked about, and Jackie or Every might want to talk a bit more, is what we call IAP, so access to psychological therapies, which is a lot of which is online, so online basic therapies, but that's another really effective way of supporting something. I don't know, Jackie, can you say a bit more about IAP in Enfield? Sorry, Jackie, are you?
She's trying to get off mute, but I'll hold. If you get off mute, that's fine. I'll ask the next question, and then hopefully, although I think that might be Jackie or Every to take this one. This is, it says here, what plans will you put in place for those with a hearing impairment or dual sensory loss, for example, deaf blind, to access mental health services as the lockdown eases? During the lockdown, the voluntary sector has provided first aid to this client group. There's been constant contact to reassure and to listen to fears and anxieties. I'm very concerned that someone will become ill due to the lack of support and access during the pandemic. So can maybe Jackie or Every? Or Andrew? We're all on mute. You need to come off mute, guys.
Every, can you just explain a bit about, yeah, thanks.
I think always, hopefully, mental health services, we are catering, if you like, for people with special needs. And we will continue to do so in this instance as well. So, for example, let's say in inpatient settings, but I'm sure in the communities as well is the same. We use things like special translators or interpreters. We use visual cards to communicate special needs. But I think IAP services, like you mentioned, Andrew, as well, probably we like to do some specific work with this group of individuals who may need some extra support during this period of time.
I think that's a key challenge, isn't it? Ensuring that people have got access. I mean, there was a comment earlier on, and I thought I'd bring it in now where it's relevant, about you've got the crisis telephone line. But is there another way to access? Because I guess if you're deaf, you may not be able to use that service. Are there online services or even those who might not be online? Is there another, how would they access that service? Jackie, I think.
Yes, I'm sorry, I'm now on mute, so I'm having trouble coming off. I don't know what was wrong with my device. I'm not clear about what services we can offer over the phone for people who have got hearing difficulties, but I'll certainly look into that and come back to you, Priscilla, about that. So you can pass that on to the people on the call.
Yeah,
but just to support what Every's just said, yes, IAP services, very important services, talking therapies, people really appreciate IAP. They're still available. They are available to be accessed via virtual if you'd prefer to do something on screen like this, or in face-to-face.
Thanks, and we've just got the IAP services on the chat, and what we'll do is, as we issue, we'll try and do the Q&A responses. We'll include all of these links and telephone numbers. And just to say, you know, I'm working my way through the questions, and hopefully we will get through as many as we can, but I unfortunately may not. Just looking at our time now, we've got 5 minutes to go. We've probably only got one other question here, but it was around young people again, and it says, what help is there for young people as isolation and loneliness has hit them hard?
Yes, I mean, I you know, the CAM services are there and are available. Certainly there's, I'm not directly familiar with all the sort of like the detailed sort of support services out there. But yes, obviously our CAM services are people as something. I'm sure there's also sort of groups and things that can be accessed to help people who are feeling lonely, or at least for us to signpost people to the services that would be able to help them.
And actually, again, if on our website, Healthwatch, we've got access to, I think, an app and a group called Kooth, Kooth, and they provide support for young people. So again, we'll try and add that link. Sorry, Every, were you going to say something, or did I just?
Yes, I wanted to say about the fantastic work that our CAMs have done in the community services. Now they have worked very closely with schools. Actually, we have produced a video which is now also in YouTube for self-help. And I think, you know, it's very important for young people. They like social media, and I think our CAM services have done a fantastic work working with schools, youth services, and to provide information of how to deal with isolation and loneliness, especially for young people and other groups as well. But in this instance, a lot of information out there, a lot of self-help. But like Jackie said, our CAM services remain very much engaged in this particular period of time.
Thanks, that's helpful. It's good to know. I've just got a question, and I'm now, my scroll bar is, Jenny has just come through to ask a question. It says, I'm going to put one here. Why is there such a discrepancy? And I'm trying to scroll here. So, sorry, I will ask this question. Why is there such a discrepancy between what different services have been offering people already in their services at this time? So I think it's basically, you know, again, it's back to maybe people on the ground are not necessarily experiencing what actually is being said here necessarily. And I guess this, you know, we're getting feedback that people might well be struggling and not sure how to access those services. Don't know who wants to take that. Andrew?
I think, well, again, we obviously want to provide the right support, the most appropriate support. I think our general advice would be, if someone is feeling that they're struggling and they need some help, contact their GP is probably the best place to start, and their GP will refer them on to us if that's appropriate. And again, our helpline is really important source of help and advice, and of signposting to some other area if that's appropriate. So we definitely want to encourage people to come forward. Don't sit at home and be anxious. Please do contact either your GP or our helpline, and then we can get you the support that you need.
Okay, and one last question. I'm conscious of time. We've got 1 minute to go. I'm just going to throw it in here. It says, any specific support for BME population? So anything that you've been able to do in 1 minute around BME and supporting the BME population around their mental health?
Well, we're doing some work across all. We're working with the local authorities around that, because obviously people will know that those from BME backgrounds are at a higher risk from the virus. In a sense, it's perhaps not anything specific, not anything different from the rest of the population, but what we're all trying to do is to make sure that those who need that extra help and support are made aware of it, and sometimes it is that people from particular communities are just not aware that the support's there or how to access it. So events like this, information on our website, on the Healthwatch website, is really important. But we're all very aware that for some people are at higher risk from the virus, and we've got a particular need to support them.
Okay, thank you. That's been helpful. So I just want to clarify a couple of things. So hopefully all of the questions that have been asked or that we've received, that I think I have pretty much asked all of them. So I'm a little bit concerned if we think we haven't asked all of those questions, but certainly the questions that we've received we'll respond to. And I know Andrew, yourself have put some information together, and we'll be writing up the notes for this. So we hopefully will summarise that information, and equally, hopefully this recording that we'll be able to get out in a couple of weeks. The other thing is, obviously, do fill in our survey, let us know, because we're all learning as we develop this, and I know some kind of aspects work better than others. Some prefer the chat, some prefer to ask pre-prepared questions. But I think what's really helpful is that you've all managed to join us. I think that's really important, that you're listening, and that actually we've got our partners here, Andrew, Every and Jackie. Thank you for your time and sharing the information with us. And I think it's about having regular calls, regular opportunities to converse and update as things change. And then the last thing I wanted to mention, apart from thank you to everyone, was we are looking to have a call for public health in a couple of weeks, I think on the 22nd of July. So again, we'll be advertising that shortly, so do come and look on our website and see our adverts to join that one, because again there'll be messages about keeping safe, keeping healthy. So some of those anxiety issues that you're concerned about, actually from public health, may be alleviated, because they can give you the stats and the data to show you how safe it is, or you know what's reducing, and how to ensure that you can go out back into the big wide world in a safer way. So thank you again for everyone for your help and support, and I will end the meeting. Thank you. Take care. Take care, everyone. Bye.